Hello all, this is Michelle. I'm a nurse here at Parkview Regional Medical Center in the emergency department. And this is my coworker Christy and my friend. We're going to try and give you a look into the life of what it's like working in the emergency room during these crazy times of COVID. We'll first be greeted by one of our friends here.
Hi, my name is Brooke. So my role is to screen everybody here that comes into the ER. I'm placing a mask on everybody that comes in for the safety of our healthcare workers and you.
So this is the hallway. We send all our patients down alone. But it is for the good of the family members to be able to take care of anybody. Here's our lovely triage nurse, Christina.
Hi, so I am the triage nurse. I have patients come back here after they've been to our main entrance and I screen them for any symptoms of the coronavirus. If we find that they have any symptoms or possible symptoms, then we make sure that they're put in the proper isolation and send them back so that they can get treatment pretty quickly.
This is where they have to screen people. We now have plastic over everything in order to be able to protect all our folks' registrations over here.
I'm Bethany. I'm with registration here at Parkview Regional Medical Center in the emergency department. Our workflow has definitely changed a lot. We used to be able to go into the patient's room and physically have a conversation with them and verify their information, any insurance questions, anything like that. Now it's all over the phone, no longer going into the rooms to really cut down on exposure. So it's definitely been a task, but we're getting it done as best we can. I feel pretty safe. I know that everyone we work with is definitely taking the proper precautions.
My name's Candace and this is Megan. We're patient care techs here in the emergency room. We have to wear masks every day. We've been wearing head caps to help keep us clean. As far as like cleaning rooms, that changes a lot. If we have a potential exposure in a room, we have to shut that room down for 2 hours, let it sit. And then we have to call EVS and they bring up UV lights. They do a whole disinfectant of the room. And then we kind of have to gown up, glove up, mask up, go in there and do a whole nother sweeping clean of the room before it can be made available to other patients. It's been a challenge, but it's something we definitely have tolerated very well and are doing well doing.
We have been loving the folks that have been loving on us during this time. We appreciate all the signs and all the food that they've been sending us our way. It's keeping our spirits high. It makes it a lot more bearable.
My name is Dr. Tyler Johnson. I'm an emergency physician here at Parkview Health in Fort Wayne, Indiana. We've had a lot of dynamic changes. We're seeing a lot of patients with COVID-19, but regular patients too. Really where and how we see patients has changed. We try to put patients in certain areas that don't have it and then try to keep people that have it separated. We've prepared for these things, so we kind of understand what's going on. Our families definitely fear these kind of things, bringing it home or visiting other families and things like that with all the restrictions. Some people are living away from their families in separate housing and those kind of things, apartments or vacation places and things like that, trying to limit the exposure since we are in it every day, all the time. Really, we're just trying to take care of patients and keep things going, and we're open for business and seeing patients that need to be here, and we just encourage people that if they do have a health concern or would normally come for an emergency, that they come to the emergency department.
Hi, I'm Angela. I'm a nurse here in the ER. We're taking a lot of precautions. I have this respirator mask. Most of us here in the ER do. We take it seriously. We don't want to be guilty of hurting people. But to be honest, I'm a lot more afraid of people not coming in. I don't want to see people ignoring stroke symptoms or heart attack symptoms that have long-term consequences. Just try not to panic. Everything will be okay. We're here. We want you to come in. Don't wait for medical care.
Hi, I'm Alethea.
I'm James.
We've created these new roles to help with COVID, and I'm the COVID partner today.
I'm the runners.
So basically, our goal is to have one person that gowns up and goes into the room, one nurse. That way we're not using as much PPE, we aren't exposing as many people. So as a partner, I am the nurse out here that is running to go get medications, running to get blood cultures and lactic tubes and things like that. Anything that the nurse doesn't have in the room, I can bring to her so that we can lessen the exposure. So another way that we are helping lessen our exposure with COVID is we have these baby monitors that we've brought in, and one goes into the room and the other one stays out here. That way the nurse that's out here helping can chart. We can know what the patient needs and what the nurse needs in there. The nurse can just tell us through this baby monitor instead of opening the doors and all that type of stuff. We're able to communicate through these monitors.
Hi, I'm Helen. I'm one of the nurse leaders here in the emergency room. My role has probably changed the most by trying to protect my staff members here in the department and doing things a lot differently than we're used to.
Okay, so I'm getting a medic run soon, and we think that it could be a COVID positive patient, so I'm just preparing myself to go into the room. So first I'm going to put on my PAPR hood, and so I have to put the belt on first, and then I'll put the hood on next, and I have to turn it on. And then I'll have my spotter here who's going to help me make sure that I have all my stuff prepared. And I'm going to put the gown on here. And then she's going to help me tie the gown. And then I'll grab some gloves and put those on. And then I'm ready to care for my patient.
Hi, I'm Jessica. I'm with the X-ray department at Parkview Regional Medical Center. For my everyday role, we now have to gown up with a mask and goggles and a hairnet. We are also taking extra precautions and sanitizing the entire machine down in between every single patient, making sure that everything is clean before we move on to the next patient.
I'm Mindy Kurtz. I'm the director of the Allen County Emergency Departments. The emergency department, of course, is the first line of defense our facility has. So we were encountering COVID patients before we even really recognized it. So I think it was very important for us to be implementing our PPE and all those precautions before the hospital even was ready to take those actions or even knew that we had some of those concerns in our community. We think a lot about keeping our patients safe, and we wanted to continue that, but we also really wanted to make sure our staff always felt safe. They had what they needed to be able to provide safe care, because that was very, very important to them and thus to us.
I'm Audrey Honeycutt, the Nursing Services Manager of PRMC's ER. Our community has been amazing and supportive. It truly makes you realize why you do this job, why we're open, why any of us ever chose to work in the emergency department was to take care of our community